Yeah, so one project, which is just like in its close to final stages, we're about to hopefully get to publication. It was a couple of papers I worked on with a larger team of co-authors, where we've studied the health conditions of migrant construction workers associated with mega sporting events. So there's been a lot of attention given to some of the issues associated with the World Cup in Qatar. And a lot of people have provided evidence of, conditions that are very difficult for workers working on some of these projects. So we were trying to assess what broader evidence base is there for this? Do migrant, because across the world, the construction industry has a heavy component of migrant labor involved. It's not just in Qatar. So that's one thing that was very interesting, because I worked with 4 other researchers, all of whom have very different expertise. It's such a niche topic. So that was one project, which I think is just the tip of the iceberg. I think this is something people need to continue working on. And then the second project that I'm working on, which is at a very early stage right now, I'm just sort of drafting my ideas on this. It relates to what we call vocational education or technical training and migration. So basically looking at migrants who are coming, labor migrants from Pakistan who are coming for jobs in the Gulf, and how there's this entire sort of focus on providing them with technical skills and vocational education to benefit them in terms of their experience in the region. This comes from a broader concern that migrants who come from South Asia and from, Pakistan's my case study in this project, that when they're in the Gulf, they face a number of challenges. And one of those challenges is that they are unable to satisfy their employers' sort of requirements because they don't have a correct matching of skills. And so somehow, when workers complain of not being paid well or not being paid properly, not being paid what they were promised, or having some kinds of negative experiences in their workplaces in Qatar or in the GCC states, that when employers reasons for this, they'll often justify on the grounds that, well, we thought we were hiring this worker who had this skill and expertise, and then we got them here and they didn't have it. So we had to invest in their training, or they weren't able to do the job properly. And so that's why we had to reduce their wages. So I'm just at the stages of unpicking some of this. I did field work in Pakistan a few years ago, and I'm drawing on those interviews with migrants, return migrants, and their experiences in the Gulf, and trying to think through this lens of education, technical training. So those are 2 of the projects I'm right now focused on. It's a complicated answer. We're still in the midst of it. So even for researchers, we're still in the midst of trying to speak to migrants and learn from their experiences. But I have done a bit of this. I mean, I've had lots of conversations with people over the past year. The experience varies. It varies depending on the sort of category of migrant sector they're working in, the nature of the work they were doing, because obviously the pandemic and the virus has affected everybody who's working, but people who were in skilled or highly skilled positions, white collar professionals, many of them, while they were of course affected, they were still able to work to a great extent remotely. When many of the Gulf countries, by the last spring 2020, they imposed like lockdowns, business closures, sectoral shutdowns, and that had a sort of diverse impact. So again, if you were a banker or a teacher or a professor, you had work challenges, but you were able to continue to work from home, continue to earn, even for those who perhaps had salary reductions, and professionals also did have salary reductions, of course, particularly in private sector occupations. They also had the sort of financial, social resources and their own networks to help them cope with some of those immediate, challenges or loss of wages. For migrants in other sort of non-highly skilled sectors, again, there's a variation. So some labor migrants, lower skill migrants had to continue working even when some of the Gulf countries have imposed a full lockdown and sort of almost like a shelter in place. The order was in place in some countries. But people who were working in construction continued to work by and large because construction was deemed an essential sector, which had to continue operating. Again, that wasn't just in the Gulf. Many other countries also deemed construction to be an essential sector. Those who were working in, say, grocery stores and pharmacies, or as security guards in hospitals, and many other critical infrastructures which still had to be maintained, like telephone and lots of other things that are critical to the functioning of a country and a society. They had to continue working, and so that meant they obviously were at heightened risk of exposure to catching the virus, and had anxiety, were nervous because they were still engaging with other people and not able to fully socially distance or work from home. But by and large, at least they were working and still able to earn salaries, and so financially that precarity was not that bad. But others who were working in service sectors, working in restaurants, working in shops, working in hotels, working in multiple places which require face-to-face contact with others. I mean, working in a beauty salon, working as a hairdresser, those businesses completely shut down. And so, since they weren't operating at all for a couple of months, some employers were, of course, still trying to pay salaries, and so migrants were able to withstand that. But within 3 or 4 months, many sort of businesses which rely on like cash flow started either reducing workers' wages or completely not paying workers and just providing accommodation and sort of food allowances, or providing food directly. And so those people were really in a very difficult position. Migrants not only need their wages to meet their own daily needs. I mean, even if your food and rent is covered, they have families at home. And in certain cases, you're not just your immediate family, but your extended family is depending on your wages. So that was a time of great anxiety for a lot of migrants, and we're still not out of it. What the states did across the GCC in most cases, they tried to, put in place regulations whereby employers were still meant to maintain the salaries and wages of their workers. But they also, I think, recognized when we were into a couple of months of this, that for some businesses, this wasn't sustainable. So they put some measures in place saying that you had to ensure like certain basic needs were being met, and where possible to try and pay a portion of the wages for those sectors which were totally not operational. The states, however, also, they offered loans to many business sectors, saying that if you're unable to meet your wages directly through your own resources, you can take loans. But many businesses were reluctant to take on loans, particularly because for some businesses it was impossible to even gauge when this pandemic would lift and what the future looked like. I mean, would this business still be functional post-pandemic? And again, we are sort of in the midst of it, although the Gulf cases have largely stabilized. The 6 GCC countries are doing really well with their vaccination campaigns. And so the case numbers here are not increasing that greatly. There are some businesses which have not survived. Some businesses are not operating, and it means that many migrants, workers associated with that, have had to lose their jobs and go home. At a larger level, in terms of the Gulf the states receiving states, like things that have changed as a result of the pandemic, I feel again, we haven't fully worked through what those changes might look like in terms of labor migration governance in the long term. The GCC states, while their cases have stabilized, are heavily reliant on their workforce that originates from South Asia. And as we speak in May, we know that the cases in India, Bangladesh, and Nepal are rising. Those 3 states provide a lot of the labor force to the Gulf. And so the GCC states are still really operating in almost like a crisis management mode when it comes to the inward flow of migrants, and also just the management of migrants. I think one of the long-term consequences we will see is that there will be a far greater vigilance in in vetting migrants in terms of their biosecurity and their medical and health status. This is already very much part of the labor migration governance system into the Gulf. All GCC states have considered labor migrants to be a potential source of spreading infectious disease in the region, because many migrants come from parts of the world where infectious diseases are endemic, but that predates COVID. So we already had a system in place where migrants had to go through a lot of vetting for different disease profiles, but these were things like hepatitis B and C, HIV, and those processes are actually quite difficult, and they impose and cause anxiety on migrants who are interested in wanting to come to work here. So one of my concerns is this is going to get even worse, at least. I mean, when I say worse, it is going to be a far greater issue. There will be greater logic and rationalization around the need to really ascertain migrants' health status and conditions before they get here. And while we can all understand that why that would be so, given what the pandemic has done to all of us, these processes do not really provide migrants with a good approach to managing their own health. Many of them feel the only way they can get to the Gulf is by sort of being this good, healthy worker. And when they're here in the Gulf, this means that there's constant anxiety about how they feel about accessing healthcare, because admitting that you're unwell, admitting that you need to seek medical attention immediately provokes an anxiety that they could lose their job on the basis of not being in good health. So, it's a complicated issue, but these are things which I think are going to get even more severe once we're out of the pandemic.